Hello everyone, I'm Rakshya Adhikari. Welcome to the Expert Talks. On previous episode, we have some insights on structural engineering profession. I hope you watch the show and find it useful. If you missed the show, please follow our channel and you can watch the full episode. On today's talk, we're going to have some insights on medicinal chemistry profession. So we're going to talk about some drug discovery as well. My guest for today is Mr. Santosh Adhikari. He has a Ph.D. in medicinal chemistry from the Newcastle University in UK. He is currently working as a postdoc research associate at Cambridge University based in UK. Welcome to the show, Santosh.
Thank you for having me, RCG.
It's my pleasure to have you in the show as well. So on today's talk, we're going to have some insights on your academic career as well as professional life in next 40 minutes roughly. So I'd like to start with your academic life. Where you started?
So I did a pharmacy degree. It was called Bachelor in Pharmaceutical Science in India.
Mm-hmm.
Then I came to the UK to do MSc in drug chemistry. Then I did a PhD in medicinal chemistry, and now I am a research associate at the chemistry department in University of Cambridge, working in the field of DNA quadruplexes to discover cancer drugs.
I know we're going to cover that part in later in the show. So why you decided to come to UK, because there are quite good university in India as well?
Mm-hmm. That's a very good question. I mean, I wanted to do drug discovery as a career when I did my bachelor's in pharmaceutical science in India. But then when I looked at different master courses in India related to drug discovery, I did not find it very attractive. Then I looked into different websites from around the world of all the universities, and there were a few universities in the UK which I really liked, that covered the entire spectrum of drug discovery, from organic synthesis to various aspects of biology in drug discovery. And one of the courses which I really liked was the course in Newcastle University. And that's how I decided to come to the UK. It wasn't the country, actually. It was mainly the course
and the
university itself.
So tell me a little bit about your experience with the Newcastle University. How did the master go?
Oh, it was brilliant. I mean, so as I said, I wanted to be in drug discovery, but to do drug discovery in a chemist sense, you should be able to understand organic synthesis quite well. What happens is, when you do pharmacy or pharmaceutical science degree in our part of the world, either it's India or Nepal, you are not taught organic synthesis extensively. So when I came to Newcastle, I got to study organic synthesis extensively, which is a major chunk of medicinal chemistry.
So you have to study organic chemistry prior to medicinal chemistry.
I did have a subject called organic chemistry in my bachelor's degree, but it wasn't extensive. There were many things which weren't taught, and I was lucky enough to be able to learn organic synthesis from some of the great minds in the field in Newcastle. So that was really helpful.
Okay, that's quite interesting. I'd like to ask, what is pharmaceutical science? Lots of people have different understanding. I'd like to ask what exactly it is.
Pharmaceutical science, I would say, is a very broad term which deals with discovering new medicine, understanding their mechanism of action, and it also deals with how do you develop a chemical entity into a formulation like tablet or capsules. And it also deals with manufacturing of these chemical entities and formulations. So it covers a wide spectrum of subjects, I would say.
So that's very interesting. So I'd like to ask, what inspired you to be on this field?
So when I was in school and college, I was always interested by chemistry and biology. So I wanted to do something which is in the interface of chemistry and biology. And at that point, I decided to do drug discovery, and by speaking to many people around at that time, pharmaceutical science was one of the subjects suggested by many people, and that's how I ended up doing pharmaceutical science, just merely to do drug discovery in future.
So was it fascinated subject at that time?
At that time, there weren't many people who could advise me on this matter, because if you're from our part of the world, you know that people are mostly focused on being a doctor or an engineer, but
this is
there
a
aren't
very different subject.
exactly. So there aren't many people who can advise you on becoming a scientist to discover medicine, for example. So it was kind of a difficult decision to do pharmaceutical science, but pharmaceutical science degree is not the only degree which would allow you to come in drug discovery. I guess we'll cover that later on.
Yeah, absolutely. Do you suggest to study medicinal chemistry to do drug discovery?
Not necessarily. I mean, if you are interested in chemistry like I was, medicinal chemistry is the right subject. But if you don't like chemistry, and if you just want to be involved in drug discovery somehow, then you could study other subjects related to biology, like biotechnology, biochemistry, molecular biology. There are lots of subjects you can study to be in drug discovery.
So it's not necessary just to study pharmaceutical science and you want to be.
No, I mean, you could. In fact, if I had to do it again, I would have done a chemistry degree. But in fairness, there aren't good chemistry degree in Nepal. At least at the time when I was looking for it. So you could do any sort of degree. I mean, what you should do is when you're in college or in school, you should find out what do you actually like. If you like chemistry, if you like organic chemistry, because in school you can now, at least in our time, we could study organic chemistry, you could study functional groups in organic chemistry. If you like that kind of stuff, then medicinal chemistry is the right subject. But there are other subjects you can study to come to drug discovery.
That's interesting. In Cambridge University, you are also working with Professor Shankar Balasubramaniam. How's your experience with him? He's a very profound scientist and professor.
I mean, it has been amazing. He has been a true great mentor. So he has a lab in Cambridge University, so I'm one of his scientists. So on a day-to-day basis, we would be doing the actual science, whereas Shankar Balasubramanian will oversee all of our operations.
So how's your experience with working with him directly?
Oh, it has been great. I mean, he is such a great mentor, as I said before. He likes to stimulate ideas, discuss with all the scientists in the group, and he makes you think bigger, outside what you were actually doing in the lab. He wants you to come up with big ideas and think about big biological questions rather than just focusing on tiny problems. So it has been a great journey, actually.
Your academic qualification actually help you in the first place to get the professional career?
Oh yeah, definitely. I mean, as I said, when I was in college, I wanted to do drug discovery. I studied towards it, and I am doing drug discovery at the moment. So yes.
So definitely. You are quite focused or driven to start the drug discovery career.
Yes, when I was in college. I mean, to be fair, when I was in school, I had no idea what I would do. I wanted to be a rock star.
Well, that's pretty much everyone does, isn't
exactly.
It?
So
we have no idea.
Yeah. So once I started learning about chemistry and biology, and then it became clear, apparent, that I wanted to do drug discovery at a later stage, and that's what I'm doing at the moment.
That's quite helpful for people who don't really know what these subjects are. How is the medicinal chemistry is different from clinical science?
So medicinal chemistry mainly deals with discovering medicines, and it also deals with discovering chemical tools to understand biology. That's another aspect of medicinal chemistry. Whereas clinical science that deals directly with the patients. So in medicinal chemistry, you are not actually interacting with patients. You are doing everything in the background. Whereas in clinical science, you have doctors, MBBS doctors, MD doctors who interact directly with patients. So
it's completely two different area.
It's two different areas under same umbrella of trying to help patients.
Makes sense. So medicinal chemistry falls under drug discovery. Is that correct to say?
Yeah.
Okay. So I want to quickly go back to the other part of our conversation. How do you keep up to date with current technology? What resource you read and go through that every day?
That's a good question. I think every scientist on their specific field will have some specific journals they would like to read every day. So we have in medicinal chemistry or drug discovery or in general biology, we have several journals which we would like to follow.
Can you give some of the examples?
Some of the examples include any journals from American Chemical Society or Royal Society of Chemistry. The one journal which I regularly read is Nature Chemical Biology, the Journal of Medicinal Chemistry. Those are the journals. But I also like reading outside of my field. So in that case, I read journals like Nature and Science, which covers a broad range of scientific topics, from physics to astronomy to biology, chemistry, everything. So I like to read those journals as well.
So which are the online or mainstream media have the best coverage in research related to your field?
For a specific field, the main media
like Guardian or Times or New York Times.
I guess Guardian, Times, they would only cover breakthroughs, because you may not have breakthroughs every day in medicinal chemistry. So
what are you currently researching on? Can you tell me about how your research is going to support the cancer treatment?
I currently work on DNA secondary structures called DNA G quadruplexes. Basically, when we were in school, we learned that DNA exists as double helix, that two strands of DNA run close to each other. But what we and others in the field have found is that DNA not only exists as a double helical structure, it also can exist in many other structures, and one of that structures is DNA G quadruplexes, which is basically 4 strands of DNA. And we and others in the field have found that DNA G quadruplexes are really important in several biological processes, and they are important in mechanisms that drive cancer growth and progression. So my job is to make chemical compounds which bind to these structures. So the aim here is to bind to DNA G quadruplexes and treat cancers.
Who are the right candidate or student to choose research profession, especially in the medicinal chemistry?
There are 2 questions there. To be a scientist or a researcher, who are the right students? If you have a very curious mind, if you want to understand more about biology or the universe in general, then I would say go into research. Medicinal chemistry, if you are very interested in chemistry, organic synthesis, and also drug discovery, then I would say go and study medicinal chemistry. But we have a tendency in Nepal to choose a subject based on the scope of the subject. I would strongly advise that if you are planning to study something, study a subject that you actually like, that you actually enjoy. So to study medicinal chemistry, if you enjoy biology and chemistry both, then medicinal chemistry is a right subject which bridges the both subjects, biology and chemistry.
So for those students who is currently studying as a pharmaceutical science or biochemistry, so for them, is the door open to go to the medicinal chemistry as well?
It is. I mean, as I said, if you are interested as an undergraduate student, if you're interested in chemistry, then the doors are open to do medicinal chemistry. But you have to remember, in pharmaceutical science degree, organic synthesis is not a major part of the degree. So you have to put an extra effort to understand organic synthesis to be able to do medicinal chemistry successfully after a pharmaceutical science degree.
Yeah, there is sort of misconception about the people that if you study pharmaceutical science, you are supposed to sell the drugs. What's your thoughts on this?
You put it rightly, I think. In Nepal and in India, if you study pharmacy, people generally think all you do is sell drugs. But that's not the case. I mean, there are lots of things you could do after a pharmacy degree. As I said, you could go into drug discovery, you could go into formulation discovery, you could go into manufacturing of medicines, You could go into biotechnology.
It's quite
it's a broad field.
Yeah.
I mean, as I said before, when I defined pharmaceutical science, it's an umbrella term to various subjects. So it opens doors to many fields.
Student working for the university and then being a postdoc research and working with the student now, I'm sure you must have career challenges as well.
Yes, definitely. I mean, when you are in university studying everything from your books, you have no idea how the experiments are actually done. You have to be hands-on in the lab. You can be a really good student, but you can be bad in the lab as well. So that is the major hurdle you have to face when you come from a degree and go to the actual lab to do experiments. So that's the major challenge. But if you are interested in the subject, you would learn it quite quickly.
Yeah, most of the South Asian academics are more focused on books rather than the practical.
Exactly. Yeah, we the students from South Asia, we're really good in our theories, but unfortunately, because of our education system, the practical aspects of science is quite difficult for us. But as I said, if you have the right mindset, you can learn those things. It could take time, but there are, especially in the West, I mean, people in UK, I'm sure it's similar in America and Australia.
Most of the developed countries.
Yeah, there are people to help you. If you understand the basics of science, there are people to help you to teach experimental science. That's what we do for students in my current lab as well.
You have been working last 8 years with medicinal chemistry. What is the career rewards? Is it well paid or is it underpaid? Is it creditable job? Well, how do you take that?
I would say money is subjective. It pays well enough, at least in academia, to be able to afford a house in Cambridge, for example. But as I said, money is subjective. And also, if you go to an industry position, there are lots of pharmaceutical industries. They pay you quite substantially compared to academic institutions.
So we can say it's a well-paid job if you are in the private sector.
Yeah, if you are good at what you do, and then if you can sell yourself, there are plenty of opportunities.
You have been working with Cambridge University, which is one of the top university in the world. So what's the cultural difference working at Cambridge than any other university?
From my experience, I've worked in 2 universities in the UK. One is Newcastle, one is Cambridge. Scientifically, they are both sound. But what I've noticed is, at least in the lab where I'm working in Cambridge at the moment, there's much more academic freedom, which means that you could think of an idea and then design your own experiment and go ahead and do it, because there is enough resources, enough money to do all those experiments. And most of the researchers in Cambridge University are quite driven as well. Anyone who comes to this university wants to prove something. That's why the environment is great.
And you have quite a bit of resource as well.
Exactly. I mean, we have lots of lab equipments, lots of grant money to work with.
So what are the benefits at working at Cambridge University in general?
You get more academic freedom where you can do, if you are rational enough, then you can design and do your own experiment. I think that's the main positive point.
Is there any difference in terms of being a foreign student and being a home student or staff?
I would say no. I mean, if you can speak the language quite well, I mean, there are people to help you in any aspects. And Cambridge, I have to say, is a very multicultural society.
So they do support
foreign
nationals.
Exactly, and then you find students and researchers from all over the world in the university. So I don't think being an outsider is a negative. I would say everyone is treated equally.
Do you have work-life balance working at Cambridge?
As a scientist, that entirely depends on you. If you manage your time well, then you would have good work-life balance. I have to say, when I was a PhD student, I didn't know how to manage time properly. So I was struggling around that time, but now I know how to manage my time. I know when to design the experiment and not to do my experiments in odd hours, like in the evening or during the weekends. So yeah, there is a good work-life balance.
So it comes to time management in general.
It comes to time management as with any other job, I guess.
If someone is looking to be expert on your profession, what's your suggestion for them?
If you are interested in chemistry and biology, or if you're interested to study in the interface of chemistry and biology in drug discovery, then I would say study pharmaceutical science or biotechnology or chemistry degree, and select a master's course or a PhD that you actually enjoy, that you actually like. Because at the end of the day, you have to do these experiments every single day. So if you don't actually enjoy what you're doing, then it's meaningless.
You have to see science as your passion rather than just
exactly.
a job. Where do you see the drug discovery future is heading in next 5 to 10 years? Do you see this career as a good career?
I would say so. I mean, you would need human minds to make drugs for the next 5 to 10 years, but artificial intelligence could cover various aspects of our life. So I'm not sure what will happen after 10 years, but I think medicinal chemistry would stay. You would need a human brain to design a drug and then synthesize it in the lab, unless someone comes up with a really smart solution of doing robotics and chemistry together. As a matter of fact, there are lots of labs in the world who are working on this, which is called flow chemistry, designing robots that would do their chemistry for them.
That's interesting. So you see this profession as a growing career?
Yeah, I don't think this would fade away. I mean, you don't have to worry about medicinal chemistry.
I mean, I'm quite reluctant. If I pick this career and next 5 years, I'll probably finish my study, and by that time, if the career fade away, then would it
that wouldn't happen. I mean, the way we do drug discovery might change, the way we do chemistry might change, the technicalities might change, but the profession would stay, at least for near future. I mean, it's very difficult to, as I said, predict what will happen to the future in this artificial intelligence and machine learning world.
I agree, like the workflow or mechanism to treat disease would change, but you still need to be within the same ecosystem, isn't it?
Exactly. I mean, within the next 5 to 10 years, or at least within your lifetime, it may not change that much, but again, as computing power and artificial intelligence power keep on growing, maybe computers would be better at designing drugs than humans are, but it's difficult to predict at this stage.
So I'd like to quickly go back to other part of the conversation. Is it possible to do drug discovery research, especially in the least developed or developing country like Nepal?
It is possible. I think the main factor is obviously money. You would need world-class instruments to do drug discovery at this scale. You would need sequencing machines, NMRs, mass specs, and all these machines to be able to do research regularly. And also you need a supply of reagents, gases,
and probably human resource as well.
Human resource as well. I mean, it is possible, but drug discovery is very expensive. To give you a perspective, a drug discovery project generally take between 5 to 10 years. I think in a country like ours, where we are trying to do things instantly, whereas in drug discovery, it takes quite a long time to get that actual result. So I don't know. I mean, this is not my area to say what we should do in terms of getting those fundings, getting those grants. I guess the government could start some initial incentives. For example, the machines I told you about, the government can start labs where we can share these machines. Rather than one lab using one machine, you can start a facility where many labs in the country can share this facility. It is possible,
but it's expensive.
It's very expensive.
I'm sure, like, if we are thinking about 5 to 10 years research, I'm sure there need to be big investment to do these things.
To do a fruitful research, I would say. I mean, again, you can do many things with less money as well, but that's a different topic altogether.
So how is it possible to get into that direction for the least developed country?
As I said, again, the problem is money. But even if you have money, there needs to be a lot of homework done in terms of collaborating with academic institutions and pharmaceutical industries locally in Nepal as well. We can have a really practical based courses where students can do internship in pharmaceutical industries, learn about chemistry. I mean, you could do many.
It's a difficult thing,
yeah.
I guess.
Yeah,
but it makes sense. I think we probably need to build the foundation at least from the human resource level as well as the basic facility, I guess.
At least with teaching students what happens if you study pharmaceutical science, what sort of career pathways you can take. Because as you said before, the fact that if you study pharmacy, you would be a pharmacist selling medicine still exists in Nepal. So if we can teach students that there are other fields you can go to after studying pharmacy degree, like medicinal chemistry, pharmacology, many things. I mean, bioinformatics, chemoinformatics, you can go into in the interface of computers and drug discovery nowadays as well. So there are lots of things you could do. So if we could teach that more.
Is it necessary to do PhD prior to doing research in medicinal chemistry?
I mean, to work as a medicinal chemist, I don't think you need a PhD. A master's should be sufficient if you can gain experience through industries. But to do research in an academic setting, I think PhD is necessary.
Sort of benchmark for the research.
First of all, there's a lot of competition to stay in academia. If you don't have a PhD, I don't think you'd go very far. You may start as a research technician or assistant, but I don't think without a PhD it would take you that far, at least in academia. So I would recommend doing a PhD if you are interested in a research career.
You're working at Cambridge, and Cambridge is one of the profound university across the world. So if someone is planning to or thinking of a study at Cambridge, is there any process they have to follow, or how does that work?
So to actually,
especially on the master or PhD level.
So for masters, there are some scholarship. I don't remember on the top of my head, but Bill and Melinda Gates Foundation do some scholarships for masters for students around the world. You can check that. There are other scholarships. I think Chevening scholarships is one of them. I don't know if it still exists, but the Cambridge University website has a detailed list of scholarships you can apply to. For a PhD, there is a route where a PhD is advertised like a job, and then you can apply directly to that PhD position. If you think that your qualifications and your interests matches the project which is being advertised, then you can apply through that. For a job that I'm doing at the moment, it's a job advertisement. I felt that my qualifications and experience matched the job profile, and that's how I applied.
Okay, so for the people who are not very academically strong, but they are in the mid-level, do they have opportunity to apply and study in the Cambridge as well?
Yeah, as you said already, Cambridge is one of the best universities in the world. I think to come here as a student, I would imagine that they would select students with quite good scores. But if you have shown your academic capabilities by other means, for example, if you have done an internship at a pharmaceutical industry, or if you have done a volunteering or a charitable work and you want to study,
or even if you publish some papers.
Exactly, or if you publish some papers, although your marks is not good, then you can
support.
Yeah, that can support your application as well. But the key thing is you have to study quite hard.
I agree with you as well. You have supervised some of the PhD students as well. Can you share some experience around that?
So I've supervised master's research students, and I work with PhD students closely now as well. I mean, in Cambridge, most of the students who come to do their PhD and research projects, they're all really bright students. Sometimes you learn more from them than what you actually teach them. So it has been a great experience, I have to say. I mean, to be able to, I don't consider myself teaching them. I'd like to think as I'm working with them rather. So it has been a really good experience. I have learned quite a lot from master's students in various areas. I mean, you don't always have to talk about a specific medicinal chemistry or chemical biology topic in lab. We talk about the range of scientific topics in the lab because our lab is a mix of scientists from different fields. We have a computer scientist to a cell biologist to a medicinal chemist. So we have scientists from all over the world in different academic fields. So yeah, it has been a learning experience for myself.
Yeah, absolutely. What's your experience being as a student, PhD student, and being as a supervisor? Is there any difference you found?
I mean, as a student, as I said before, that you know a lot about the theoretical aspects of science, but you're not very good at an actual experiment. You're not hands-on in the lab. So those are the things you would learn once you spend more time in the lab. That's the only thing you have to learn, I think. I mean, there are other things. Time management is one of them.
Yeah, you become more mature when you get certain level of experience.
Exactly.
Do you think name of the lab and academics also matter in terms of doing research?
Unfortunately, it does. I mean, it shouldn't. It shouldn't matter, I guess, in the modern day of doing science. If you are from a small lab, but if you have brilliant ideas, you should be able to compete with other big minds in the world. But as in other fields, I mean, if you are top of the game, your name actually matters in science as well. So if you are in a bigger lab, you'll get bigger exposure when you go to finding jobs afterwards. But again, I mean, if you also come from a small lab, but if you have shown that you're actually a capable scientist through publications and your conferences and stuff, then it doesn't matter that much.
So is it correct to say being at the top university or top academics, it's easy to pitch your idea to the larger audience?
I don't think so. I mean, at the end of the day, I mean, if your science is strong, then it doesn't matter which university are you from. If you are in a big university, big lab, then obviously you will have more resources to do your experiment. It might take you 2 years in a small lab to do the same experiment, whereas because you have new modern equipments, you can do the same experiment in a shorter time frame. That's the only plus side, I would say. But if your science is strong, I don't think it matters which university you come from.
Yeah, makes sense. We are at the very much end of the show. I'd like to ask a few questions. Do you have any suggestion for the student who are currently doing research or who are planning to write thesis for the master or PhD?
I mean, the students who are already at the stage of writing thesis, I mean, they would know a lot more already. But for students who are planning to do research, I would say be focused. Do what you actually enjoy. Select a subject that you actually enjoy rather than going after a scope in one country, because science has a bigger purpose than just finding a scope in one country. So if you like finding truth, if you enjoy scientific subjects, just pursue the dream. I mean, if I can be here, anyone can be here.
Do you have any suggestion for those students who are planning to do pharmaceutical science and they are probably confused where they're gonna end up after their study? So do you have any suggestion for them as well?
I mean, if you are in pharmaceutical science, if you are currently pursuing the degree, there are many subjects inside pharmaceutical science. See which subject you like more and then go after that subject. And don't get disheartened by the fact that people would think that pharmacy is just selling medicines. It's not just that. There are lots of things you can do after a pharmacy degree. It has a wider
scope.
Exactly, it has a wider scope. You could do many things after a pharmacy degree. So I would say don't get disheartened. Focus on your studies, and then select the subject you like the most to do your specialization or a PhD or your future studies.
I think that's pretty much for today. Thank you very much for talking on this expert talk.
It has been a pleasure. Thank you for having me in your show, RCC.
It's my pleasure as well. I hope you liked today's show and find it useful. We're gonna come up with a new episode next time. Please leave your comments and feedback on our channel, or you can reach out to us via email. Our email address is the.expert.talk@gmail.com, or you can follow us on Twitter as well, TheExpertTalks. Thank you very much for